The following exercises may be recommended by your speech-language pathologist within the setting of a diagnosis of head and neck cancer. Please complete the exercises the number of times your speech pathologist has recommended. That might include up to 3 to 4 times a day. The following exercises have been evidence-based and researched to demonstrate improvements and maintaining swallowing function while undergoing chemoradiation therapy. The first exercise, you are going to yawn. At the height of your yawn, you're going to hold it open for 3 to 5 seconds. Yawn. Relax. Yawn. Relax. Very good. The next exercise, you are going to gargle. Do not gargle with mouthwash, but you may use water or a baking soda recipe, okay? So, do not use any medication with this gargling. For me, I'm going to take a sip, gargle. You may swallow or spit it out depending on where you are in your treatment and your discomfort. Again. Keep going. I'm going to complete 2 more. Last one. Wonderful. Now, the next one is going to work on exercising the base of your tongue. You are going to stick your tongue out and pull it all the way back, holding it in the backwards position for 2 seconds, like this. Pretend you are trying to scratch the back part of your throat. So out. Relax. Out. Relax. Out. Relax. Out. Very good. Okay, the next exercise. Swallow hard each time you swallow your saliva, your food, or your liquid. So, when you go to swallow, place something in your mouth. Think of it as if you're swallowing a golf ball, squeezing the muscles of swallowing all the way down. That is an effortful swallow. It will help to push food down through the throat safely and keep the muscles working extra hard. Now, the next one you're going to do is your Masako. This is one of the exercises that you will continue to do for forever. Stick your tongue between your lips, keep it there, and swallow. Stick your tongue between your lips, keep it there, and swallow. If it is too difficult to place it between your lips, place the tongue at the roof of the mouth, behind the front teeth, keeping it there, and swallow. I want you to do 10 of these. If you run out of saliva, take a sip of water in between, not with the exercise. Good. Very good. Remember the other placement behind the front teeth and swallow. 2 more. Awesome. Okay. Now, the next exercise on your worksheet is going to be the Shakir exercise. That exercise is going to be completed lying down. If you have a feeding tube in place, complete it reclined in your either lazy boy or recliner. So for this exercise, what you're going to do, pretend that I'm reclined in my recliner. I'm going to bring my chin to my chest and I'm going to hold it there. Chin to chest. And you are going to hold that exercise starting at 30 seconds, working your way up to 1 minute. You're going to complete that exercise 3 times in a row. Oftentimes people will do that one before they get out of bed since they're already lying down. Remove the pillow, you are flat on the bed, chin goes to your chest, working the muscles of the neck, okay? Now, the second part of that exercise is you complete it in the same position, but you do not need to hold that exercise for the full 30 seconds to 1 minute. Instead, you're going to be lying down, okay? And you're going to bring your chin to your chest in one fluid movement. So again, pretend I'm lying down or I'm in my recliner and I do this. 1, 2, chin to chest. 3, 4, 5. You will complete that one 30 times. That exercise is called the Shakir. It has been shown to help with opening your esophagus. Do not skip it. It is very important. Okay, now the next exercise. This is the Mendelssohn, and sometimes people's least favorite. So what you're going to do is you're going to swallow. When you swallow, you're going to feel something go up. Hold that up in the middle of the swallow for about 2 to 3 seconds. So for me, I'm going to come up. Let me go like this for you. I'm going to swallow. And let it drop. So I feel my voice box come up. So swallow. And let it drop, okay? Again, this exercise, if you run out of saliva, can be done with sips of water in between, but not food in your mouth, okay? You're going to complete that exercise 10 times. That is another one of your exercises you will always do for the rest of your life. So really, we want to get good at that one. So swallow. 2 seconds, let it drop. Swallow. Let it drop, okay? 10, total of 10. Okay, now, the other one is your jaw stretch. Again, you're going to work keeping the jaw moving. So open the jaw. Hold it for a count of 3 to 5. And the last one you want to do is moving your jaw from side to side. Very good. These are, again, a series of exercises that might be recommended by your speech pathologist before you start chemo or radiation therapy. Make sure to follow their recommendations and continue to keep your appointments.